Hi guys, so we're still Trailguide to the body. This time we are featuring page 238, 238. Okay, we are doing the trail 3 quote unquote horseshoe track. So looking at image 5.24, here we have the hyoid bone. I have mentioned before the hyoid bone is floating bone, and it's really articulated or dependent upon the superior suprahyoid and infrahyoid muscle that really moves this particular bone. Okay, when we swallow, when we talk. Okay, so we have here the thyroid cartilage, we have the cricoid cartilage, and we have the thyroid gland, and of course the trachea. Okay, this is the anterior view of the neck, meaning anterior is the front view, posterior is the back. Okay, so we have the trachea here, we have the cricoid cartilage, thyroid cartilage, and hyoid bone as additional features here. So the trachea or windpipe is located at the center of the anterior neck. It is a ribbed cartilaginous tube that is roughly an inch in diameter and is deep to the thyroid gland. So the cricoid cartilage is a slightly larger ring of the trachea superior to the thyroid gland. So the thyroid cartilage or Adam's apple is superior to the thyroid cartilage below the level of the chin. Okay, present in both sexes, the thyroid cartilage is larger and more visibly protruding on adult males. Okay, remember, we have that Adam's apple. I think everyone's aware of it. So the three structures are partially deep to their slender infrahyoid muscles, so yet are easily palpable. Okay, so the horseshoe-shaped hyoid bone is located superior to the thyroid cartilage, as you can see here, right? It is roughly an inch in diameter and lies parallel to the base of the mandible or the jawline and the third or fourth cervical vertebrae. So the hyoid bone serves as an attachment site for the suprahyoid and infrahyoid muscles. So it is accessible and elevates upon swallowing. So keep in mind, guys, here, look at this image here where the partner is being in a supine position and the therapist is gently accessing the structures on the front of the neck. Keep in mind the neck is very sensitive area. Okay, we don't even do extension as a therapist. We're doing extension of the neck class as opposed to other range of motion, right? If we're doing assessment and we're trying to investigate where the pain is coming from, right? It is our job to make sure that we're doing no harm to the client. So looking at the information here with regards to trachea and cartilages. So partner being in supine or seated position. So we're using a finger pad and thumb pad to palpate. So gently explore the anterior surface of the neck for the tubular trachea. So number 2, we're going to slide your finger up and down to feel the trachea's rib surface and slowly and gently shift it from side to side, noting its pliability. So the cricoid cartilage can be isolated by sliding your finger and thumb superiorly along the trachea to just below the thyroid cartilage. So explore first large ridge surface. Sorry, my apologies. So number 4, we can slide superiorly from the cricoid cartilage onto the thyroid cartilage. We're going to palpate the sides and central tip. I think I'm tired. This is going to be my last video for tonight. I'm going to proceed for the next page, guys. So you're going to ask yourself these questions, okay? Are you at the midline of the neck? Midline, again, is the center of when you're in anatomical position. Lateral is going towards the end side. Medial is towards the midline. Okay? Can you distinguish any rings along the tracheal surface? Filipino accent. Sorry. Is the trachea roughly an inch diameter? With your finger pad on the thyroid cartilage, ask your client or your partner to swallow. You feel it move up and down? So in this image here, you have the crooked cartilage here. The therapist is trying to palpate the trachea and cartilages. Okay, so the tired cartilages sometimes refer to the Adam's apple, the name derived from a folk legend that describes the biblical Adam's first bite of apple became stuck halfway down his throat. According to the legend, his male descendants, with their more visibly protruding hard cartilage, appear to have carried on this condition. See you guys in the next video. I'm tired, so I'll see you guys tomorrow. Love you guys, and God loves us.